child health is my passion, but I ran away. Very few people know the story, so I won't say it. But I know all my favorite pediatricians, all my friends, all our colleagues are listening to this morning show. Because this morning we're doing two things. Anyway, the Orange House Lounge is here on your radio every Saturday from 8 a.m. to 10 a.m. And on the Saturdays, we talk about health. We bring you perspectives of experts. And we also give you a chance to weigh in on our conversation. Our show is live. We're streaming on YouTube at Orange 1079 FM. And you can also join us in the show on WhatsApp if you've got a comment to make or something to say. So today I'll let my guests introduce themselves. And then let's get the show on the road. Today we're talking about injuries in children. And at the same time, we're also celebrating a decade, like 10 years of the pediatric intensive care unit. And who better to start with the intros than the boss himself?
Thank you very much, Dr. Jima. And good morning to your listeners. Again, to the management for giving us this opportunity to have a chat with the public. And as you rightly said, we are dealing with children. In a big medical world, we say pediatrics, but then children. I am Dr. Med John Adabie Appiah.
Okay.
I'm a pediatrician. That's a specialist health doctor who treats children with diseases, childhood diseases, and illness. And then I also work at the pediatric intensive care unit of the Komfo-Anokye Teaching Hospital.
Okay. All right.
Thank you.
Thank you. And next to you?
Good morning. I'm Ellen Opoku Danquah. Also a nurse at the PICU. Okay, so eventually I take care of the case.
Okay, so Ellen is a nurse at the PICU. And then
Good morning to you. So my name is Dr. Elliot of Akoto.
Okay.
So like Dr. Adabie said, I'm also a pediatrician. I also take care of children. And I'm also affiliated to the pediatric intensive care unit.
All right. So we have people who take care of kids this morning with us. And, we're talking about injuries in children. And good morning to you, Dr. Frank Cerebro. For those who don't know, the GMA president is a pediatrician. He may not look it, but he's a pediatrician. Good morning to you, Dr. Cerebro. Good morning to you, Dr. Hilda Mantibia Boy as well. You're all tuned into the show. So, Dr. David, let's start with the 10 years of what we call the PICU, but for the general public, that is the Pediatric Intensive Care Unit. It's such a big composition of words. What happens there, and what's that place like? Why is it even there?
What happens at the Pediatric Intensive Care Unit is a place where children who are severely sick or severely injured and have in life-threatening situation. When I say life-threatening situation, means that their organs, their body is not able to take care of itself, and then if nothing is done, no major intervention is given, the patient most likely will die. So more or less, it's when an injury or disease has advanced to the point that the body cannot handle it again.
Okay.
That is when we say you are critically ill or you need intensive care.
So it means that your unit is where It's like the last stop when everything else is not working.
Basically, yes.
But why is it just 10 years old? Like, Konfanochi is 50.
Yeah. And
no, Konfanochi is more than 50 years old, isn't it?
Yeah,
or 50?
more than 50 years.
Yes, more than 50 years old.
Approved.
I think Konfanochi is over 100.
70, going to 70. Yeah.
Going to 70.
Yeah.
So, Piku is like less than 10 years old.
Yes.
Why is that? Why did it take us so long to decide that we needed something like that?
What happens, I mean, for every institution, you start small, and when Konfanochi started, even elsewhere, pediatric intensive care unit wasn't a big deal, a big area where people were concerned about. The subspecialty itself, or the specialty itself, it's very young when it comes to the rest of the world. It's not only Konfanochi. When I say very young, as compared to the others, I'm comparing it to others, and that's the reason I'm saying it's very young. But for elsewhere, it's been in existence for about 60, 70 years.
Okay.
Konfanochi is only 10 years. And actually, it's not only Konfanochi, it's the whole of Ghana.
It's the whole of Ghana.
The whole of Ghana. Konfanochi established the first pediatric intensive care unit in Ghana.
Wow.
And if you look across West Africa, at least the English-speaking countries, with the exception of Senegal, the whole of West Africa, with the exception of Senegal, they had some semblance of an intensive care unit for children.
Okay.
Nowhere else had a pediatric intensive care unit.
Wow.
Yeah, so now the question is, why that late? It was that late because we have had challenges with the human resource. We've had challenges with even the concept of establishing the pediatric intensive care unit. Intensive care unit actually grew out of surgery. And then because after surgery needed a place for patients to recover. So from the recovery ward, those who do not recover actually get into intensive care unit. And anesthesia was a place where actually they started intensive care. But eventually with growth, it came out in different places also. There's Baden, also other subspecialties were Baden. So aside intensive care unit, you have pediatric intensive care unit, subspecializing into cardiac intensive care unit. So specific areas. You have brain, those who take care of brain, those who take care of surgical and other areas. So this is how the growth has been. It's taken Ghana and West Africa a long time to get here, but we arrived, and this is thanks to the effort of successive Konfanochi management, and then also some of our own colleagues. Successive Konfanochi management, I can talk about Dr. Insiasari, Dr. Patrick Kakari. I can talk about Professor Hinieje. I can talk about Professor
Apalu.
Dr. Apalu also playing a significant role. And then our anesthesiologist,
Dr. Nchukwusi, or Gabriel.
Yes, Boachi.
Yeah,
yes, Dr. Boachi.
Yes.
He is retired, but they played a major role in getting us this far. And then also Professor Samson Entry, Professor Lesko Akoto, Professor Emmanuel Adiobo, Dr. now Professor Planju. They all played a significant role in us getting this far. Advocacy, speaking on behalf of getting someone trained. Strategically, it started with Dr. Kakari, the past medical Patrick Kakari. I was having a chat with him, and then after the establishment of the pediatric emergency unit, we noticed that mortality had gone down. I looked at the data, mortality had gone down. Fairly stable for the first 5 years. We brought it down from 12% to 5 to 6%. But we got to 6% and nothing was changing. So it's like we got stuck. Looked at what was going on and realized that there is a limit that pediatric emergency unit will do for all the sick patients. It's able to resuscitate the patients, but a few number of, or some of them will go back into severe illness. So beyond resuscitation, we needed something to do. So after having a chat with Dr. Kakari, and then Dr. Kakari mainly, we came up. We also had colleagues from US, University of Utah, coming down with other colleagues from Ghana, especially Dr. George Oforia Manfo of blessed memory. He actually became a mentor personally, and this is where everything started. I remember when Ghana College started, he initially put some form of curriculum together, but there was no one to lead it because we didn't have an intensivist, pediatric intensivist in Ghana.
But I mean, Dr. Adabie, it means that it's taking a lot of effort, a lot of collaboration to get to 10 years of having a unit within a hospital that takes care of severely ill children. You know, for adults, if you hear somebody's in an ICU, just imagine it being for a child. So that is what the pediatric intensive care unit is. Let me come to Ellen, my good friend Ellen. Ellen, how did you end up as a PICU? I mean, we'll come to injuries in children, which is a big deal because my child came from school yesterday with his lips swelling because somebody kicked him. But that's a different matter. But how did you decide to become a pediatric nurse? Like, why did you even decide? There were other things. You are going to ENT, eyes, less stress. Do you like the adrenaline rush?
All right. I had passion for kids.
Okay.
Doing everything, it comes with passion.
Yeah.
So if you don't have that passion, it's not easy to become a nurse at the PICU. Because seeing kids getting sick, losing them, it's a whole new process and it's difficult too. So I decided that since I have passion for nurse, I should do passion for kids. I should do something to help them.
Something extreme.
Yes.
But is it mentally difficult to work at a PICU?
Yes.
Yeah, I can imagine.
Mentally it's difficult. So sometimes when we lose our kids, we go for a psychologist to come in and talk to us.
Wow. Dr. Elliot, you're also a pediatrician. You are biased towards the pediatric intensive care unit. I'm sure you've seen it go through all the processes. Like, someone is listening and they have very little appreciation for what it means to have a child at pediatric intensive care. Like, what does it mean when they say, you know, like in Chi, Yadobaniko Piku? Should you be scared?
Do you want a straight yes? No.
No,
okay,
I mean,
let me. Yeah. So
I want an answer that the general
the
public
way
will
we can
appreciate.
make the public appreciate what intensive care is. We all watch movies, right?
Yeah.
Yes, we see people rushed with the ambulance to the hospital. They are asleep. Most of them, they are not conscious. They have this tube in their mouth. They have these machines on them. The heart beeping. They have all those machines. That is the picture of intensive care.
Wow.
And like Dr. Adabie earlier on said, it is the place for the most, the sickest or the most critical.
The most
ill.
critical.
Yes. So those who are most at risk of dying, either they can't breathe, either their brain is failing them, either their heart is failing them, and without the intervention that will be given at the intensive care unit, they are basically dying. And that's why I think she was alarmed when we said that, why now? Because that means that before intensive care.
Okay, like what was happening?
Yes, a lot of children were dying, right? And even that, we are not saying that PICU is able to save all of them, right? But it's made a difference. So these are very sick children. And so yes, it's not a nice thing to be at the ICU. And so we try to make it as comfortable for them as possible, speaking to them and all that. But it is, in quote, a scary place, right? Yes.
I understand.
Like she said, I mean, there are times when you have to call it and say, this child, no matter what we do, the child is not going to survive. How do you communicate that to the parents? I think this week we just had one. A parent who was in denial. couldn't accept the fact. Yes, we have, like she said, doctors ourselves, I think, having a toll on us
because you give off your best,
yes,
your all.
Yes. And sometimes you have children, you're putting yourself in the shoe.
Exactly.
This could have been my child.
This could be my child.
So it is not easy. Psychological aspect, it is not easy. But you were asking them why they became intensivists. For me, So for me, mine is that I like the fine tuning. I don't want to start with you and leave you, right? I want to see you to the very end. I want to make sure we've done everything we are supposed to do for you. I want to make sure that kind of perfectionist attitude, to make sure that all those details are done for you before. Yes, are taken care of before. Yes, so that is it. Yeah.
If you're just tuning in, we're 23 minutes past 8 o'clock here on 107.9 FM or in the Orange House Lounge. As always, my name is Dr. Jima. You've been hearing the voices of Dr. John Adabie Appiah, an inspiration to a lot of us. Some of you don't know. I mean, when we were in med school, he came. I don't know where he came from, but we had a lecture with Dr. Adabie Appiah, and all of a sudden we all wanted to be pediatricians. All of a sudden, like, you saw somebody who made it like, okay. So, there's this side of the work. So, he's one of the people who made us, want to be pediatricians. So I did my child health, came to the department, and realized that every day we are doing silver collection. I ran away. I realized every day we're doing silver collection. I'm not going to come to work with money in my pockets again. And then I ran away. But I mean, I'm always biased to pediatricians. But Dr. Adabie, so for someone who doesn't know PICU, what has the success story been like over 10 years? Have we measured ourselves to see that the kids who are coming in are doing better? And is there room for PICU to grow?
Thank you very much. So I remember just after coming back from my training in Cape Town, South Africa, I looked at the data that we had at the intensive care unit. Then the intensive care unit was at the the accident and emergency unit. Of the total number of patients, of more than 2,000 patients admitted over the period that the ICU was established, I think 2007, 2008 to 2016. That's about 8 years. They had admitted close to 2,000 patients. Out of that, only 220 something. So just about 10% were children.
Okay.
But the burden of critical illness is overwhelmingly in children.
Yeah.
So why this difference? So let's put that down. After we established the unit, within one and a half years, we had reached that milestone that it took 8 years for the general
emergency
ICU to achieve. So that tells you that you have provided, the patients were there, they were not getting the opportunity to get in for various reasons. That's not what we are here to discuss. But that fact alone shows that we have given them the chance to make it through their critical period when they need us the most. The second one is that if we looked at the death rate, those who were then admitted, out of the 220 something who were admitted, less than 45% were surviving.
Less than 45%?
Yes, so close to 55 of them, out of 100, 55 of them would die. All right. But again, looking at the same period of time that I discussed with you, out of the over 200 that we got within 2 years, 75 of them survived the illness. So we have more than double the survival rate, more than tripled the admission rate. All right. So, I mean, that is to tell you that at least they have someone or they have a place to be seen, to be heard. If you are sick and you are spotted, when I say seen, you are spotted that you are sick, you definitely have some solutions to your problem. Just being seen that you are sick. But if you are sick and you are not seen, you walk around and suddenly you die. So that opportunity of giving them the opportunity to be seen, just that alone is that self-assuring that something is going on. And then doing the right things. Because a child is not a miniature adult.
Yes.
A child is a different species altogether.
But that's what we see children as oyopinyi kitwa.
And only ye how kesiye pa akora enye nipa kitwa. Mesanso esisubio. Akora no oye nipa fufuro. Na nipa fufuro ne nyini ba beye or evolve beye adult. Ye hwe ne anatomy, ne brain, ne tongue, ne minimum, ne con, whatever, no, ne physiology, senia moja no, ne chemicals, ne body ne mo move no. Ensuo dudu wa akora mo de totum penyimfo de ho enyepe. So into when you know all these affect the child's response to illness and even response to treatment. So monitor akora na ye ma akora na ayaresa ye monitor akora no. We monitor the child, and as we monitor the child, there are certain parameters. Me cut off no mean me kofa penyin de mbeya akora dia. So me kofa penyin de beya akora dia. Time and I said me mano intervention, you know, also I step in, or I'll wait till it's too late. And that means the child, even though it's under your care, is not going to get the best treatment, the quality of treatment. So just like we define really quality, what do you call it? The service you are providing should be timely, should be effective, should be efficient, it should be safe, and then it should center on the patient. These are the qualities, the things that we focus on in hospitals, especially in ICU. And we pay attention to the minutest detail. You can't gloss over any small detail because that might be where the problem is. So it takes us a long time to see one patient. Yesterday, I said, "Yeah, akora baako ewo ye ward." Na me time me home page me ni me share you know. Na yedi akora baako out that efidie so ne yare o de buy no. Na I spend close to 1 hour 45 minutes. And yes, surgery na hear you. Because you had the way to her, near the way to her, near the way to her, qua na so what you want review. Send your bear bet twa. Na otwa no ne yans with me akasa yen kofa sa edrowe. Yen sa edrowe in frame. It sounds say edrowe ni edrowe enhia.
Okay.
Sanyo mano na yen wo intensive care unit. Enti obeba na nipa ne no but na doctor for ni nurse for no omu gina omu na so sa.
Let me come to you, Ellen. Ellen, so I like Ellen's smile. So I always wanted to smile before she speaks. So what is bringing people to, what kind of injuries are bringing children to the PICU? Like, or there's somebody listening and is wondering, what will my child go through that will let them say, this one, you are coming to PICU? Like, is it just a common headache or, okay, Dr. Akoto, like, what is bringing kids to PICU? What kind of challenges are bringing kids to PICU?
Some of the common cases we see are burns, and then poison inhalation.
Burns. Like me and you, we know burns, but burns how? Like burns essence. And most of the time on the health lounge, even though orange is an English station, we try and blend so that people would appreciate. Like burns say, "Akwanen sa muka krebi na sheshinti ni edi na ba na say waton kwan mu."
All right. Actually, happens.
No, you see, I'm saying it because for those of us who work in the districts, it is common. Yes, you can send the picture to Alyssa. She'll project it for us. Okay, like it is very common to have a child who has gotten burnt from something hot. So you see, like that happens. Burns.
Yes. So burns like infusion, but infusion be infusion no ebegu and also county.
So where it gets is Alyssa is watching the video and she's jumping. Alyssa, you work in a pharmacy, you're a farm tech. You shouldn't be scared by these things. So burns and the area or the extensive nature of the burns will say, okay, this one has to go to intensive care.
Yes.
Okay, and you said something else. You said inhalation of
poison.
Poison.
So be out be a paraffin no aquafano.
So those things, you don't have to stay in the house, right?
Yes. So with those things, especially those things, sometimes when it happens, there's no give the person palm oil, then they'll end up giving the person palm oil. It can also worsen it. Usually also force a chronic chinchina on vomity adena or day one no.
So it means how we even give the first aid.
Yes.
Alone is enough to bring you
to the
ICU. Dr. Akoto, so how should people handle? Let's start with the commonest of the common.
Okay.
How should parents, adults, caregivers handle something like burns at home? And at which point in time should they say, I'm bringing the child to hospital?
Okay.
You and I know that by the time they decide they're bringing the child to the hospital, na atra. So what type of burns and at what time should we come to hospital?
Okay. So before I come to the burns question, just to give a little bit overview. So specifically we are talking about home injuries.
Home injuries.
Yes. School injuries is also a whole thing, but home injuries. And there are different types. I mean, a lot of children get injured in the house and don't end up in the hospital.
Okay.
So we have minor injuries or what we call moderate injuries. We have major injuries where they come to hospital, they are admitted. We have severe injuries, right? And then we have fatal injuries. So in the PIC or the intensive care unit, most likely what will end up with us are the severe injuries and then the fatal injuries. Fatal injury means that this person, if he doesn't get this child will not, if the child doesn't get medical help, this child is essentially going to die. Without a hospital, you are dying. And even some of them eventually even die with hospital help.
Wow.
Basically. Yes. So a lot of them don't end up in the hospital. I mean, we all have children. It's falling and then minor bruise, we allow them to go. Sometimes you don't even know that something has even happened. Some come through the emergency. One of the Adabie was talking, we spoke about the fact that emergency is the first point. So we are actually married, emergency and critical care, right? So you rush your child to the emergency. A lot of them go to the emergency, they are treated, they go home, they are treated, they go to the ward, they go through surgery, they don't come to the ICU, right? A fraction of them come to the ICU. So there are a couple of home injuries that happen. You're more from different things, and we'll talk about it. Then we spoke about the burns. Then Ellen spoke about poisonings. Into one kerosene, one DDT, one vitamins, fesolate, the pregnant woman, or no paracetamol, the adolescent, maintaining who has been saying, paracetamol, there's one bottle. By those things happen, as I'm calling they have choked on a coin or food or something. We have animal bites, we have car accident happening in the house. All these are forms of injuries. By the mechanism of the injury, some of them naturally won't come to ICU. Okay. So, the most common form of injury will be children falling down. About 50% of the injuries in falling. Like, but those which are severe enough to come to the ICU is what Ellen was talking about. Yeah. The burns, they have choked on something so they can't breathe, and you have to immediately put them on a life support machine and arrange for surgery and take it out. Right? We have aspiration. So, that happens.
But those things, Dr. Akoto, why? Who taught us how?
As you can see, I'm a small boy. It's been there. In fact, by grace, we have survived to now. Some of us were. And sometimes when you challenge your parent, they tell you that the same things happen to you.
Who taught people that when a child does not want to eat or swallow, hold their nose?
I came to meet it.
Elliot says, you came to meet it. But so that's what I want people to understand, that the PICU is for severely ill children. Yes. And these are the ones who are struggling between life and death.
Yes. So in PICU, we are basically living their life for them. They can't breathe. We are helping them breathe.
So you have equipment that helps them breathe.
Your heart is not functioning well. We are helping your heart function well. So let me take a simple malaria. People get sick with malaria in the house, and sometimes they don't even come to. In Ghana, every parent is a malaria doctor, right? So you are treated and you are fine. And, but a lot of them end up in the hospital at emergency. They are treated, right? Some end up in the ICU because the malaria is so severe that their heart maybe ceases to function. And imagine your heart is not functioning. Yeah. Yes. So that is where ICU comes in. So the malaria medications begin to work, right? Like it always happens. We have to support your heart to keep on beating as though you are alive, to allow the medications to work, right? Some of them become unconscious. So what the brain would have done, we have to support all that. You can't eat, you're unconscious. We have to help you eat. So you are basically living your life for you till the medications and the body's healing processes take place. That is what ICU is about. Wow. And so basically it's one-on-one. The nurses, the doctors are on you. Every minute detail, what is happening.
Everything counts.
Yes. And then doing everything for your body.
I want you to talk to parents who take injuries of their kids lightly. Since you're a man, you talk for the fathers. You talk for the younger men. Dr. Adabie is an older dad, so they are experienced.
Yeah.
And then Ellen will talk for the younger mothers who find excuses not to bring their children to hospital. Like, to the parents who, your child has literally fallen down, hit their head hard against the floor. Yeah. You were like 3 blocks away, you heard the sound. They're like, obo form. How should fathers, this one I'm genderizing it, approach injuries of their children? Because see, me, I know as soon as something happens, the first thing father thinks about it.
Yeah, so I think that part of our culture, and it's not just ICU or falls. You see how people react to a baby, let's say a newborn. And this one is like, say, MBU, MBU. A baby who is unwell and needs treatment. How we react as opposed to or compared to
an older
person. They will go and sell everything to come and pay for the bills of the man or get dialysis or get anything. But when a child is unwell, after all, we can have another one. And it's very common when they are very new, like babies, right? And I think that is where we get it wrong, right? I think the value of being parents and having family and the children depending on us is we being able to fight for them. I think we should begin to value the children, their life, right? Even if they are very unwell and we know they are going to die, making the child feel valued, and then fighting to make sure they are comfortable. And even if it's inevitable they are going to die, making sure that we support them. Because they are human beings, like Adabie said, they are not half. It's a full human being with feelings and everything, and we are supposed to support them. For the fathers,
say it.
Yes.
Say it. I know that the spirit is compelling not to say it, but say it.
What I would say is that sometimes the way our dynamics were, maybe I think as with now most women are working, it's very common if you work in the rural areas where the woman is dependent on the man for money and everything, right? And a lot of times we feel them, and I think it is wickedness. I mean, we've had times, I've worked in the village before, district before. You have times where the man will not even step in the hospital, right? I will be elsewhere demanding and giving instructions that bring my child home. For what? A child who cannot breathe is on oxygen, right? So let's change the whole idea that the child is a whole human being and then do our best to support the child. Sometimes the mothers are afraid to come out for the father's side because he's going to basically shout on me, scream on me, blame me for the one who caused the injury, right? We should see parenting as a shared responsibility, And if things happen, I mean, if the woman or if you weren't around and she knows that you are going to support and you're not going to attack her, I think she's more likely going to open up and then support
hospital.
Right, yes.
For those watching on YouTube, we have a picture of I think what's a burns, isn't it? Extensive lower limb.
It's a whole body.
It's a whole body.
He came to us yesterday. We're informed yesterday, and the injury is he fell into boiling pepper. The parents were boiling pepper. And I said, if you're more if you're not more meku. Now, ye pages your TSC formula. And I'm penny for now, I'm saying, I'm done your mongakra. Jomu ye na afi ankorano akoto. Adabie konim, minkan is Adabie konim ensu. Ehura fe ye si hon. And near yana say, ni body ni na ure mu.
Hot boiling pepper.
Yes, yeah. And Chisane see now it's very distressing.
Yeah.
You know, it's a source of income for the parents.
Yeah.
We are not saying don't do
it.
But we need to make sure that we put some safety measures in there to ensure that these things do not happen. Huni say we dreaming. So baby our juma. Baby our juma no man kra enko ne nam ho in and out. Akra on ni left and right. So nti hard drain. Kakran so American account ho ni say. So now mood ye din komo na Elliot was trying to was speaking to parents.
Parents, yeah.
Now one of our major problems as a people is that we don't count the numbers.
How?
Public health.
Yeah.
You register everything, you document everything, and count who is in, who has gone out. So if you count everybody, when someone goes out, you know. We don't count children.
Oh.
We don't count newborns.
Yeah.
You're saying, yeah, I want to say, yes, only 3 months, only 4 months, yeah, because of it, me as yewo butayanti anase adikrontia titifo no no mo yesa me feel say bi ni say na enkora wuo ne dooso.
Okay.
E kaye ya obebre indiana nam say yen ni hu edure de betua no nti we tend not to give them name to remember them. Say,
okay,
so,
all right.
And enkaye wo ye yaw ewu eya. And to avoid that, because I don't want to buy 3 months now. And I think our elderly people, our ancestors were smart, very smart people.
Yeah.
It's a psychological way of managing death in one way or the other. I'm not going to condemn them, but we have evolved to the point where we can manage childhood, newborn age killers. So most of our children are surviving. Because they are surviving, we are seeing lesser and lesser number of children die. And they, to me, we need to start counting them. We need to start giving them names.
My public health
When they get to around pregnancy is around 6 months, give the child a name. And when you give a child a name, you count the child. You invest in the child. And this is where we have been.
So Ellen is smiling. Ellen, you see, even when you people go and do the photo shoot and you expose your belly cry, they say you are inviting anybody. Anybody. Whilst we're having the conversation, the reason why I said let's talk to mothers is because there are also mothers who, you see, like today is Saturday. You are preparing to go for your friend's wedding, engagement. You've gone to get your hair, your dress, your shoe, and everything. Friday, 9 p.m., the child is hot. Most mothers will say, hey, what they do, I'm function at all. Put in, if you are lucky, some suppository. If you are not, they will grind paracetamol and give you some. Why? We've talked to the fathers, the mothers who also create this care gap to the point where it's like they want to do what they want to do before they attend to the child. Because I know you see them.
Oh, okay. So what I want to tell the mothers now is they should take good care of their kids. They should concentrate more on the kids. Let's say more than themselves. Because I would say they are the future.
Yeah.
They should concentrate more of the kids more than themselves. And also, when something happens, it looks like a child just fall. The mother will say, oh, when they need the ball, you shouldn't just conclude. First, become, some even start to beat the child. I told you not to do this and you are doing it. You should come, bring the child to the hospital. Let them see the child. If the child is fine, you go home.
You go home.
So just keep everything aside and just bring the child to the hospital. Let them
but you see, most of the home remedies that injure children, please don't come and attack me. I'm not attacking women. Come from women or mothers or caregivers trying something that they've been told into obesamo. Right? Like Dr. Adabie said, a child is not a small adult, but or parabu or no bumu half. Onimakwani wait onim he na wa hono. Then they will give it to the child. Should people still be doing that?
No. I think some of these things are as a result of some of the kidney damages. Because you don't know what's in the medicine, the things that.
Okay, because or no yes I
Maybe you were lucky you didn't die, but someone lost their life because of that.
So it's a matter of mothers also prioritizing that. And then what are some of the things that, because as for injuries in the home there, you guys have a lot of implements in the house, hair tongues, hot comb, all those things. Talk to your people. Where should they put it? Because you see, when you are using those things, the kids, they are watching you. Because I remember I have a friend whose daughter saw that, like, their dad was always shaving. And then when he was away, the daughter went and picked the shaving stick. He went and she had cuts all over the face. So how do we keep things that can injure our children as mothers away from them?
Okay. So you can keep it a place where you can lock. So you have a locker, you keep it, then you lock it. Or above the child's length. Some may say the child can stand on a chair, but make sure the place where you have placed it, the child can get closer to it. And we should be careful anytime we are done using those things. We make sure we keep it at the right place. And also be turning off our plugs.
Why?
And sometimes people do forget, and then it can also shock the child if maybe he goes to touch it.
But in this case where Dr. Adabie and Elliot were narrating that, like, a child has fallen in boiling water. So, you are cooking, you are like you are doing the octopus. You are frying fish here. You are boiling water here. You are steaming this one here. This one is in the oven there. How do you keep that home and that environment safe? And this small you will not sit at one place. Like when Alyssa was a child, she won't sit at one place. Like they will run around the kitchen. Like how do you child-proof your kitchen? Do you lock them out? Do you lock them out?
Oh no, you don't lock them out. But you make sure they stay away. They stay away from where you are doing your things.
So
let me add to this. You have to look at what you are doing, your work, let me put it, home workplace. Even if not home workplace, for instance, the staircase. If you are on the first floor, for instance, the staircase, you can put a little door there to prevent the child from accidentally falling over it. You don't wait for the child to fall before you take action. So that can be done. The same way in the workplace, you can cordon the specific area that you are working. Put a door that a child cannot go through. If you know it's the risk is high that a child can go in there. So it's not a whole area. Unfortunately, most of our society, we still have places where you have the community supporting you raise the child.
yeah.
Okay. So if you are doing that, you know that this is my workplace, and I put a door that a child cannot reach and open in there. It's not only those who cook that we see this in there. We see them in homes that they prepare soup, subsistence
Soup.
commercial. Yes.
Okay.
The alkali they use for the soap preparation. They are also bringing a lot of children. Some of the accidents that bring children to the hospital. So it's not acid; they are alkali, and kids play around. They are tired. Usually, it's in a bottle like this. This is what we store the alkali. Okay, when those who make soap at home, and the child goes to play, comes back thirsty, even not play, just waking up. The first thing he sees is this. We always have to, for the child's mind, we always have water in this. They open it, they gulp it down. By the time they realize their whole mouth, their whole throat, their whole food pipe, the windpipe, everything is melted, mashed up. You give him, so if they survive this period, they survive to the, and they cannot eat, they cannot swallow. In some cases, they can't even drink water. They need surgery. The surgery costs over equivalent of $2,000 converted to Ghana cedis.
Plenty.
Yes, because we've been working with the pediatric surgeons to see some of these. So this is what additional benefit that pediatric intensive care unit will bring. So we don't want that additional care. That's not our wish. But to prevent this, you need to take a bold decision in the house.
Make sure that
yes,
the place is safe. And you're right, you know, sometimes you meet people who, you know, like live in a flat, so ground floor, first floor, second floor, and you realize that there are kids on the second floor, and they're running up and down the stairs. Whether it is slippery, whether, like, nobody's really worried about making sure that the place is childproof.
Say kids will be kids and adults will have to be adults. Okay.
True.
We cannot stop kids from being kids.
True.
And in fact, we need to allow them to experience the world. But we need to set the boundaries. And that's our role as adults. If we don't set the boundaries, we are too liberal, allow them to go into to touch the fire. I mean, to touch fire, to touch boiling oil, which I know most people will not do anyway. It happens by accident, and it happens because the accident is because we did not set out the boundaries, the barriers that should stop the child from getting in there.
Dr. Adabie, there's a good morning to all those who are watching us on YouTube. Dr. Mate, Nia Day, Emmanuel Pong, Michael Bruce Smith, Vera, Vera, thank you for listening. Faustina Bache, whom I say I owe cake because you are probably my number one listener. Mary Joan Kipong, and then Annie, everybody's saying that's like they're really enjoying the conversation we're having, and then they're learning quite a lot. Elliot, let me ask you. It says a colleague sent a message that we should talk about children who drown at home, like water-related injuries at home, because he's saying from where he works, sometimes people feel that you can only drown in a swimming pool or in the sea, but you can drown at home.
Yes.
In a bucket of water.
Yeah, it happens. So, so like we said earlier on, there are different types of injuries, and maybe we should take each of them and how to prevent them. Yes,
Most definitely.
So I think we should start with the burns, continue with the burns that Adabie started, and then we'll take all of them. So for the burns, for us to exhaust that one of the things that has been noted to happen a lot is very commonly people with gas stoves that are on the floor, or our local muchia muka, or biofuel.
Yeah.
It's very common.
Yeah.
And that is obviously because it's at a level where the child is able to access it.
The child,
Yes, and it's also very common in fact, I worked in a district where the most common burns we saw, like I was saying earlier, was not hot water burns, was soup. And we saw all types of soup, right?
Now, how big?
All types
how
of
big
soup.
Is this?
That
soup
is
pot?
because a lot of people don't have a dedicated kitchen. So you see, we are in the metropolitan area, so we assume that everybody will have a kitchen. But there are a lot of places where they don't have a dedicated kitchen. So some will use just the opening as
area.
kitchen. So the children are playing football. At the same time, there's a pot of soup on fire, right? And they are playing around it. So like you are saying, some of these things happen because we've not educated them, and maybe that is why we are doing this education.
Yeah.
People should begin to understand that we have to be conscious that the child can get injured. We can't be careless, in quotes, right? So begin to reorient ourselves and understand these things can happen. Try to separate where you cook from where children play, and don't allow them to have. If you have money, maybe elevate it. Even if you have a single room and everything is in a room, maybe you can just partition that area to make it not accessible to children. Another thing they say, don't carry a child and hot water at the same time. I think was that 3 months ago, a grandmother who slept and then was carrying a child. The child had burns, she also had burns. They were both admitted. So one of the rules, I don't carry a child and be carrying a bucket of hot water. And it's also advised that you try to dilute the hot water. So maybe, obviously, we'll boil most of the hot water in the kitchen for most people. Yes. But you see, we'll carry the water, sometimes even with racks and then the whole pot
like it's hot,
straight to the bathroom, right? Some will also go the extra mile, probably pour it into the bucket. But it's advisable that you dilute it. So when I say dilute, just make sure that when you pour the water from the stove or from the fire, right around that area, pour water, cold water, so that as you are carrying or transporting or transferring the bucket of water, it is not that very hot.
Okay.
Before you take it to wherever you are going to use it, right? People have, how do you call it? Heaters in the house. And sometimes they don't test the water, or they allow the child to go in and operate it by themselves. And even we adults, if you've used that before, you realize that sometimes you open it, you go in, then you step back. Yes. So, I mean, especially if you have heaters in the house, make sure that you are the one who is operating, and you check the temperature before the child goes in. We don't want you to, if you have children in the house, use the front part of your stove. So you have a like a 4 burner. Yes, burner. So use the one. Try to use the back one. Yes, especially if you have children in the house, because children like to reach out. They're exploring their world, like Dr. Adabie said. They want to touch everything. So you have this pot of soup or water. They will just get there.
I know, Elliot, you are trying to make room for the parents, but we know from studies, from research that. One of the means, especially from South Africa, one of the ways children get burns, hot water burns, is the fact that if you have water sitting on top of a cabinet, and that they go in, they pull something, you put it on a napkin, they pull the napkin or something, the water falls on them. Thinking about that, I am worried that if even we put the stove at the top and still the risk is there, it doesn't eliminate them. So you look around and make sure that as much as possible, it's safe. Can put a small barrier for those age group up to about 5 years. These are the most dangerous period. in the child's life so that they don't even go into the kitchen.
Mm-hmm.
If they are going into the kitchen, it's only when you've turned
everything off.
You don't have hot stuff around for them to pull it on themselves. So we need to pay attention.
Adabie, let me announce the WhatsApp lines. 05939329993. It's WhatsApp, so you can text. You can send a voice note on 05939329993. Or if you're watching us on YouTube, you can put your questions there as well. 05939329993. That's the WhatsApp line. You text or you send the voice note to join in our conversation. Some of the questions, there are lots of questions you're asking, and I'm going to be asking my guests. Don't worry. It's just 9. We have just about an hour to go. There are a lot of things to do with injuries that one show cannot exhaust. All right. And I'll do my best to bring them back. But Ganiu is asking me to find out from the team, Dr. Adabie, that where he lives, what he realizes is that a lot of children play around the fitting shop. And he's like, it's very common in Kumasi, in areas where there's a fitting shop close by. And that is where kids are playing. And he's like, he can replay in his mind the number of times you hear a story that kids have been locked in some sports car and all those things. And he's asking that, for instance, if you find a child who is locked in, let's say, a car, a fridge, first aid, what can you do?
Okay. Thank you very much, Ganiu. Ganiu, that is very true. There are several sources of injury, or there are several types of injury that can happen to a child who lives in areas like that. The first thing is that let's look at the child. Okay, the child is looking for secured area to play.
Yeah.
And knowing that there are adults around the fitting area, mechanic area, they know they have security there. So they are not there for anything. They want security. They want assurance that there's an adult looking over me whilst I play, and I will not be harmed. That is the intention. And that's the reason why they come close to us, and we don't need to kick them out. The next step, the next thing you ask is, what are some of the things that can happen, and when it happens, what should you do? If a child, for instance, get into a car and adults will not know, lock the door, and within the car itself, you know, when you enter car sitting in an open compound with the sun on it, the heat you feel.
Yeah.
So if a child should lock himself in such cars, you can imagine they will eventually suffocate. Die from heat stroke, okay, because the heat will be unbearable for them. The same area, if they are playing around, you find battery. The battery contains lead. The battery contains alkaline. I just spoke about alkaline, where kids will drink it because they are tired. So these are some of the injuries that they can have. The lead that we find in car batteries that is used, the content in car batteries that sometimes they take it out, melt and use it for pellets, gun pellets. The kids playing around, they can put 1 or 2 things in their mouth. It can lead to major long-term problem, anemia. Yes. So these are challenges, these are problems. Ganiu also made a point where they have entered the fridge and then they are in there.
And somebody also has closed it.
Also thermal injury, just like the heat. So these are thermal injury, forms of thermal injury. Heat stroke and then cold bite and so on and so forth. The first thing you can do is that you expose the child, okay? You let the child lie flat. You don't put the child up. Don't be too quick to pour cold water on the child, to pour warm water on the child. Okay, all right. You may, because such sudden, drastic, high temperatures can also cause the response, the treatment can also cause further injury to the child.
Okay.
So I would say don't be too quick to do these things. If anything at all, pick a towel, dip it in warm water, not hot water, not cold water, okay, and then sprinkle it on the child and leave that. If the child is too hot, to cool the child. If the child is too cold, to slowly warm the child up. You don't want to quickly do these things because they create injuries. If the child is not breathing well, you want to breathe for the child. You want to hold the child's mouth. If you don't have anything, breathe through into the mouth so the child can.
Okay.
You want to, if the heart is not beating, you want to do chest compressions, what we call chest compressions, like trying to help the heart pump so that it can deliver blood to the brain, to the vital organs. As you do this, or as opportunities allow itself, you rush the child to the hospital. We won't recommend that, especially, for example, kids, when they are having some problems, you hold the kid's legs up and then the head down. It's very dangerous.
Like holding the kid upside down.
Upside down. You don't want to do that.
So they want moja to go to the brain.
Yes. Some other things that we don't want to do is that if they put something strange in their mouth, you haven't seen it in there, don't blindly put your finger in the mouth and sweep it. If you can see it, yes, try and go beyond the whatever is in there and take it out. But if you haven't seen it, don't do anything because you push it further down and the child will go into severe respiratory distress. It will complicate the work of the doctor who will eventually see the patient. Right. Kids who have taken in anything, we shouldn't be giving them things to drink, to swallow.
Palm oil.
We are used to doing palm oil. You are right. You're right.
Palm oil.
Palm oil. And in most of the cases, it's the palm oil and the follow-up that we try to induce them to vomit that kills them. So it's not what the child did, but eventually the unknown parent who thinks he's doing the right thing rather complicate it and make the child's condition worse. So if you don't know anything to do, just take the patient to the nearest healthcare center and allow the healthcare center to advise you, or treat the child. That will be the safest for every child.
It's 9 minutes past 9 o'clock here on 107.9 Orange FM, and this morning on the Health Lounge, we're talking about childhood injuries with the team from the Pediatric Intensive Care Unit of the Confanochi Teaching Hospital, Dr. John Adabie, Appiah, Ellen Opoku Danquah, and Dr. Elliot Akoto. And if like the response is enormous, like people, I think it's because we don't teach home first aid. I think it's because we don't encourage people to have first aid kits even at home. So, Ellen, like the most common thing that nurses will do, and I think I said I was going to donate a first aid kit to my child's school nurse on Monday. Like, still use things like gentian violet. Like, that the child is washing shit. That hot water has poured. Then they apply all sorts of things on the child. Should adults have first aid kits that they know how to use? More importantly, that they know how to use at home.
Yes. My advice is everyone should have
a first aid kit and know how to use it.
Yes.
And know how to use it. Someone wants me to find out from you that do we talk to parents and do we talk to people about car seats and how they're supposed to place them? What if I'm driving and I see sometimes I just want to stop and ask the person, you give me the child, maybe you don't want the child. I see fathers, and I've seen some mothers do it too. They place the child on their lap. about Adabie, or you're doing it on Snapchat or Instagram or something that we don't know. Like, why would you do that? Do we take our time to let people understand that this is risky? And I don't think that we do. I think you should organize a tour at Piku for people to come and see the kind of injuries that we have. Because we talked about burns, we talked about inhalation. What's the cutoff age for Piku?
We do mostly do up to 14 years, but we've admitted kids as old as, not kids, adolescents as old as 18 years. Okay. So yes, we can go up to 18 years and even beyond. But our target is the children.
Ellen, a young nurse wants to know that how can I become like you? Hey, Ellen, you are becoming celebrity on my show. You have to pay me, you have to pay me, you have to pay. Someone is asking that, how do I become a Piku nurse? Hey. You are making Ellen blush in the studio, please. Like, how does someone become a Piku nurse?
Oh, okay. So before you can become a Piku nurse, you should be a nurse.
Mm-hmm.
And now we have courses for intensive care at Ghana College.
Okay.
So you can enroll in Ghana College to do an intensivist.
Okay.
Okay. And then if you are not an intensivist, you can be a normal nurse and get trained. Like me, I was trained to be a Piku nurse. So gradual training, you can end.
So my young nurse, you see, gradual training. You can go to Piku and go and look for Ellen. She'll give you she'll give you guidance on how to be a Piku nurse. Dr. Elliot, earlier on you mentioned about animal bites, and now people have pets. Thankfully, I don't like dogs. My ideal pet is a goldfish, a fish in a tank. That is my idea of an ideal pet.
Yeah.
Something that doesn't bark, something that doesn't shout. But a lot of parents, a lot of adults, a lot of homes have dogs.
Yeah.
At what point should that animal bite compel you to take your child to hospital?
I think from what we've been trying to establish is that for you, your only duty is that if there is any first aid, know how to use it. Right? So maybe we'll talk about the first aid, but almost always come to the hospital, like Ellen said earlier on. I mean, if it is nothing, we are just going to tell you that there is nothing, go home.
But sometimes people feel like, so I've come to collect card. I've come to, the nurse has checked my vital. I've come to queue some 20 minutes.
That's
I've
why
come
we
to
are
a consulting room. And people say,
yes. So
and I can tell, say, no, that's what people think.
Yeah. It's not everybody who comes to the hospital that will be admitted.
Okay.
Yours is to bring the child.
So don't keep it in your mind that you'll be admitted.
Yes. And don't think that it might be something.
Yeah.
For example, the 4 that we spoke about, that at times they've probably started bleeding, right? And their complications have not yet manifested. They'll manifest later on, right? So maybe the child fell, like you said, he had kum or enyeshe. 2 hours time is when the child begins to show the signs. If you had come earlier on, right? So yours is to, if you know the first aid, some of the things that Adabie has said, apply them. But come to the hospital for us to say enyeshe. Let the enyeshe come from us. Let the enyeshe
come
from us.
I think I prefer.
Yes.
I think it's the mentality that Kamai, they say Kamai.
Yeah.
And it's not a big thing beer. And then they say, yes. Ellen, do you like dogs?
Yes, I love dogs.
Then Ellen, you're not my friend because me and dogs.
Dogs and dogs. Even cats. Even cats.
Boss, you have dogs too.
Yeah. He loves dogs.
I have post-traumatic stress disorder.
You've been chased before.
Don't worry, Doctor. Ruth is there. We send you to Ruth for something.
No, you see, the thing is that when you haven't done anything to the dog, like you're going or somewhere, the dog starts chasing you. I don't, So, and it happens to children. So you're going to say something, Ellen.
Yeah, I want to say vaccination is very important.
So of the dog, eh?
Yes. So if you have a pet,
a pet.
Make sure you take the pet to the vet. Make sure the pet is given the dose he needs, and especially the rabies.
We don't pay attention to those things, so it's like, oh, if you come and so.
Remember, knowledge is growing in our region. We are also getting into specialization, and as Ellen just said, the vets, we have to make use of our vets. So even you with the tiniest animal in your house, your pet, the fish you are talking about, you still need to see the vet. Okay, you still need to see the vet. If you have birds, you still need to talk to the vets. If you can't talk to the vets, read a little bit around the type of bird, whatever pet you have, and know what to do for the sake of the health of the population. WHO has recently developed something they call One Health. Which covers everything. You know better than me, but One Health covers humans, animals, the environment. So everything that lives within the environment, because we are interlinked. Health depends on all these. Whether something will spread wild or not, whether something will kill an individual, depends on the environment. So my recommendation or my suggestion is that if you choose to have a pet, whatever pet, you can talk to the vets. The vets are very learned, they are well educated, they can advise us in this area. And let's not sublet this function to our own. Okay, we are all specializing in our area, and we have less knowledge in other areas. So don't assume that because you live with them, with your menina with your say with your crama away with your miami crama, there be making mistakes. Me share say me kora abua komo innocently crama or cry to in some cases even birds end up de abewu with rabies. A big chair as late as 8 months.
Wow.
Abuana can all calculate
8 months.
Yes, I feel no the ababewu. So me was enka na ya abuana ho ban. Anka ensisa. Si amo abuana ho ban na aboni pane so ho ban a. Enka I see abuana tea no ka no. Wanya wadne so we the idea tinki bi so nti meyi so ka 8 months later down the line nka on mambewu. Wow. Yeah. Me bi.
So it's listeners. So it's important. It's not the big. You shouldn't think about like the big bite. Think about the small ones too, Elliot.
Yeah. So I think that Adabie made a very important point about rabies. We think it is dogs alone. Cats.
Someone is so.
Cats also can cause rabies, and monkeys. People have pet monkeys in the house.
Yeah. When did I see a monkey recently? What you run about?
Yes. So
I saw someone selling a monkey.
Yeah.
And I was like, no, this person should be arrested.
I think, like you said, we have to allow the vet to do their work, and we have to be responsible. Most of the dog bites we see are not children in that same house. A lot of them, it is children from other houses and all that. So,
but Dr. Elliot, you go to somebody's house, then they'll say, "Oh, come on, onka saying."
Yeah, so I think that's how we are educating ourselves. So first of all,
if I come to your house and I hear "whoa," I'm outside. Like I won't.
Children are adventurous. I mean, some children.
I know.
They enjoy it. When I have to jump a wall or when I have to be stubborn, they chase me. Like they are happy. So we have to be responsible as parents. You don't raise children free range. This agric science.
Like it's a type of animal husband.
Yes. You can't do that. If the child lives in the house 2 o'clock, 6 o'clock, but where he went you don't know. What he does you don't know. I mean, this is not a child who is getting good care. So we should be responsible for our children, right? And then you who owns a dog also, apart from the vaccination and all that, make sure that they are locked. You know your dog is wild. Make sure they are wild. I mean, if you have taken that initiative to own a dog, then probably you have to go the extra mile, get in a cage.
So please,
probably
dogs,
wall in your house,
cats,
yes,
parrots,
yes.
Please.
So take the extra mile, wall your house, close the gate, chain them when you have to chain them. I think we all have responsibilities in terms of we, the parents, and then the owners of the
Yes,
dog.
and I like the One Health concept of Adabie. Sometimes you will see that your dog, you woke up in the morning and the dog has, you can tell your dog is sick. You understand? Drooling, bleeding from the nose, and you think it's normal. Like you've left the dog is roaming about. It's probably harboring something that it can pass on to you. Majesty J is asking that what is the first aid you can give a child immediately an accident happens? What?
It depends on the accident, the type of accidents we are talking about. So for the things we've spoken about, for like the burns, you spoke about the injection, caustic soda, maybe you can give them water, milk, quickly rush to the hospital. But if the child is unconscious, don't give anything.
Don't give anything. Just bring the child to
hospital.
Elliot, how should we...
Let me add to what Elliot said. So you have to do a quick, we will say, examination or assessment of the child. Okay, so you ask yourself, when it happened, whatever accident that happened, the first thing you want to ask is that, is the patient breathing? Okay, so look at the patient. If the patient starts struggling to breathe, we actually start from making sure that air is actually going into the airways, the mouth, into the lung. So if you don't feel like air is moving, there's a sense of the child choking in any way, noisy breathing in any way, you don't want to delay, you don't want to do anything.
But you don't want to delay. How should you bring the child? Like me, I work in the district. Yeah. How do I bring the child then? Sometimes I have to start and go like, no, train.
Yeah.
You know, let's get... How should someone transport... You're trying to say a child has been involved in an accident. Quickly, the strongest...
I'm say, no, my chassis and freezer be say, yenina who be pain. You could have phones, smartphones, you hear TV, no. So be prayer, you had need to stretch us. So, and you had an echo. Me feel say, oh, pesa audio be called hospital. The best ne say be would never to be a stretcher. And say, what tabo cry and I'd never to swam, and in that so a flat. So, pejani train cosro, funny and a 9 cents. I said, Appiah. So, baby, Nipanya Appiah. Uyana says, son said, ni ya pan is a sabra nipani prana, untuminia bibiano, upese mojano, a cobi or say cobia. And say nipane da flatter, and they wouldn't how.
Okay.
So, how many year easy, say mojano hat need to pump out a pump a crack, a crabbing a hat, ni pump crack, a bit me a conagin, a keeping alive, a bit me a flow to a hat, a keeping alive, a bit me a pump a con a lungs, a call chin oxygen. But ye pejano. Ye danino, ye yeni say what?
No, it need Jamaica.
And ya as Americania yam shishia nebua, as Americania yam shishia no eku and crofo be accident is now beconi say recently BB Christ Parliament just before and no near Panis a bassa manipani nafo. Mem pejani panin collapse why mem pejani panin
that was such a terrible manindafom into somebody collapses manindaho.
Yes.
Okay.
And tumrika and coffee and sue and goodness. Oh. And tumrika and command and sue no. And fa be unim near cause. What ya opeso when he said Nipano and frama 8 me call. Nipan ne homeno ne chest a movie up and down. And yes, a tumrika. So, and I said, yes, a nya. So we all know how to.
Okay.
And then Anna or see a say, or pulsa. Na come on, a ye free be pulse near. In tinino, more than in name more, command bar, na Odon sat 2 in tinini to say ya. So, which be say a bones, and only pulse. Ut me Edon sat a shiny con have. So, Nipanoko umia so back how don't say obe feel say in tinino airbo. In Sentini body naturally say baby a nipan wono a ye. We know you'll be a what on to mean cast on to mean on young conscious. But depending on cast, I'll be maybe some saying be your key or he find a ya a hot ya chassis assess me a chassis free sabreno. And who says society pan we determine so oh wait dear Appiah me womreka kra on one cast with me at nasi oh ubit me at nasi honey ubit me at there be metia me ya man in the whole flat. So it's a what pejano no sa a inina me the or how kesiye ebre akorana nipana and as akorana we pray.
Okay. Dr. Elliot, Modesta is saying that, for example, if your child falls into hot soup, do you rub raw egg on their skin or pour cold water onto their skin before you make your way to the hospital? This one maintained now.
Vaseline. So, or rub anything on it, there's a chance we want the little bit of the skin to still be on it. Number two, you introduce infection. And a lot of hospital, in fact, a lot of children with burns come to die. It's because later on they get infections, right? The most recommended thing is not Vaseline. I think there's a general thing in the public that the first thing to apply Vaseline, and that's because of the fact that Omba hospital address here the Vaseline gauze. That is later on when the wound we wanted to heal. But in the acute phase, Vaseline, oil, and stress. What they say you can do is lukewarm water.
And ice water. Normal tap water.
Yes.
Hopefully, if your taps are flowing.
Yes. They remove whatever hot Appiah in water. You remove that because it's still hot, right? And I say you remove those ones. So you remove those ones, and you can quickly pour normal water to wash the hot thing away. And then you bring the child. After doing all that Dr. Adabie said, making the child is breathing, that you bring the child to the hospital. Unfortunately, if our emergency ambulance system was working properly, I mean, this is the best thing. You stabilize, they come to pick the child. Yes, and then the issue about how to transmit and all those things will be sorted out by them. But we don't have that really functioning well, right? And that is what we are talking about. This is so you do this. Right, just watch and bring the child to the hospital. Okay,
so let me announce the phone lines now. So you can join in on our conversation. 0541 022 318, 0541 022 318. Please, when you call, turn down the volume on your radio set, and then whatever you want to say, I will definitely hear you. 0541 022 318. That's the phone line. To call us on this morning if you've got a question. Good morning to you, Akia Oswa. Oh, Akia, you still owe me a day on this show. I won't say anything. Thank you for always doing the listening. 0541 022 318. Someone is saying that kindly ask the nurse when you have a child who cannot talk like a baby and they swallow something. Our mothers say hit the back. Can she tell us how to do it properly? Ellen, before you come to that, let me pick this call and then we'll come to that. Hello, good morning.
Good morning, Doc.
Yes, your name and where you're calling from, please.
I'm Emmanuel, calling from Abuasa.
Yes, Emmanuel, go ahead.
Yeah, I want to find out what if a child swallows like a fish bone? How do you take it?
You're saying, how do you take it?
Yeah, how will you take care of it? Maybe the child is taking soup and then swallows the fish bone and then it stuck in the throat or something. And the child says that she can feel that the bone is still there.
Okay. All right. Thank you very much, Emmanuel. Thank you so much for the call. 0541 022 318. Guys, fish bone. Fish. Those of you who like the fish head. Why fish head? Okay, let's keep that on nice. Let me pick this call as well. Hello, good morning.
Good morning.
Yes, your name and where you're calling from, please.
Please, I'm called Adabie, calling from Pawade.
Okay, Adida, kindly go ahead.
Please, there's something I would like to add to your conversation.
Sure.
I think parents should also learn to teach their children. Anytime their clothes catch on fire, they should teach them how to lie and roll. Because more at times there was an incident whereby the clothes caught on fire. Instead of them to catch the child was running. So the fire was increasing because of the air. But if, let's say, the child's clothes caught on fire and the child lie down and roll, the fire will go off. So I think parents should also know that and teach their children so that anytime their clothes catch on fire, they can lie and roll instead of running. It will complicate everything.
All right. Thank you very much, Adiza. Thank you. That's really good education. So fishbone. Kase in here
Okay, so I think saying in I am collapsing, and I can say here in I pain. I mean, sometimes it's very easy. you drink water, swallow something, and then it goes, right? But the moment and most of the time, fishbone is not going to prevent. If it's causing things like what Adabie spoke about, the child cannot breathe, and then all that. You don't try anything.
Okay.
It cannot be dealt with by you. You have to come to the hospital.
You have to come to the hospital.
Yes.
Let me take this call. Hello, good morning.
Good morning.
Yes, sir. Your name and where you're calling from, please.
I am Nana Ankuma. I'm calling from Asante Gabi.
Okay, kindly go ahead, Nana.
Yes, our grandmothers used to grind a herb called Ejuna Habani. When there was a cut and there was severe bleeding, the other chew it and then squeeze the green liquid and then the pop and place it on top of the place where there's a cut, and then the blood will stop. I'm just asking those in the villages now, they are fresh people, new people, so that when there is an emergency case cut and bleeding, they should quickly go behind, the house and look for a Juno Ahabani. Grind it on a grinding stone, add some water, and then squeeze the liquid and place the pulp on it. Okay. Now, the thing is that I was teaching chemistry at Aboku State College, and because of that idea, I used to test the element of calcium, because I knew calcium stops bleeding. So my students and I did that kind of a test, and we saw that Ejuna Habai contains calcium ions. Okay.
All right. Thank you. That's some, new knowledge there. But the bottom line is that whatever you do, go to hospital after that. And even with that, you may have already exposed yourself to some level of infection. Someone was saying a follow-up to the fishbone. He's like, even when you drink water, and sometimes they'll say, Ellen, impacted, you like fufu. I can see from your face. Like, it will push the bone down. Yeah. But you still feel like there's something there.
If I would advise that, that might even complicate it more and cause sometimes just the water and what you were taking may push it down.
May push it down.
But it doesn't come to the hospital.
If you still feel like there's something
because
there.
Something impacted chest, it's fishbone.
Yeah.
It's probably stuck.
Oh, don't worry.
Yes, true.
I have watched that continency before.
Yes.
And they have a fish there called Appiah. If 10 people eat it, 6 will come with fish bone.
Yeah.
And I don't know why they still eat it.
And sometimes they have to be taken to theater to
remove it.
Yes. So sometimes it becomes complicated, even tears through tissues and all that.
Wow.
So it is not as simple as it is. And one of the things here is that, like Dr. Adabie said also, try not to remove it yourself.
Don't put your hand.
Yes, you might be causing more injury. So I mean the normal drinking of water, what you were eating, the normal bolus, right? They didn't solve the problem. Just come to the hospital. People have ended up in theater because of fish.
Don't be embarrassed. Just come and say that I was eating fufu, I was chewing the tilapia head, and then now I feel like it is there. And virtually every doctor will ask you to go and take some imaging, so we have a look at it. If it's there, they'll say it's there. If it's not there, they'll say it's not there. Yes, Ellen, the kids, the babies who cannot talk, sometimes they swallow things, and Rebecca said, like, bonnet, your bonnet is saying, remember, like, what's the technique if your baby swallows something and you want to push it out?
Okay, so how do I say?
Mm-hmm.
So, Obedane Akran.
Mm-hmm.
So, Udanena. Then at the back, you hit it. And don't just say Bonikesi. Try to push it. If in case a shower, it's near coffee, Amanaba. But I'll try now. You bring the child to the
hospital. We'll do it for you. And you see, come to the hospital and tell the first people you meet at the hospital are the nurses. Who, you understand? And don't judge. Oh, sometimes when you go, it's like next week they means me can't something. Tell her say, me bana mini crayon, eraser, pebble, something, and they will start the process. Someone says that he swallowed ice cube some time ago, and it wasn't easy for him. He's wondering how fishbone. He's wondering how fish bones will feel. But 0541 022 318. That's the call. 0541 022 318. Should we have things like fire extinguishers in our house? Should we have a fire extinguisher in the house?
Yeah. I personally had an experience. I just told myself, if we didn't have this extinguisher, what will we do? So when the doom so thing was going on, there was a time we had a high current.
Okay.
Then our meter just catch fire.
Wow.
So me, as a lady, I was afraid. I was afraid. We were just there, and the light also came back. So at that moment, the meter is on fire. The light is also on. What would we do?
Wow.
So then we realized we had
a fire extinguisher.
Let me take the opportunity to add to this. To add to this, that it's very important that every house should have a fire plan. Okay, fire safety plan.
Yeah.
And this can be sorted. You can get this from the fire service.
Okay.
One of the roles that they do is to help us plan fire safety in our house. So you invite them, they'll come and inspect their house, they'll give you advice, okay, on what to do, where to place what. They'll discuss it with you. And as I said, knowledge is growing. So many of these professionals are there to help us. They are not there to punish us. They are not only there to, fire service is not only there to quench fires. They will also help us prevent it. In our house, in our offices, I can see, what do you call it?
So we have a sprinkler.
Yes, sprinkler here. Yeah. You should have
a smoke detector.
Detector, okay, in your house. So with that, reduce the incidence of thermal burns, fires in the house and thermal burns. We've discussed extensively hot water burns. We didn't go much into thermal burns.
Let me pick this call and then we'll continue. Hello, good morning.
Hello, good morning. Please, I just want the WhatsApp number.
Okay.
Yeah, WhatsApp number.
Okay, 059 39. Okay, so you're going to write it. Okay, I'll repeat it. So the WhatsApp line is 059 39 32 993. 059 39 32 993. That's the WhatsApp line. 059 39 32 993. Adabie, someone is asking about iron. Like, I know I've seen a lot of young ladies. I don't know why you put iron on the bed. There's ironing board. I don't want to pass. Ellen, this one is personal attack. Like, you see a lot of people, and you realize that like they have iron bands, and I don't know why people, or maybe you don't have an ironing board, but if you have something like that injury, like say iron shower, should you come to hospitals? Iron ashing you. Yeah, you know, like if it's an adult, cool, but if it's a child, I think you should come to hospital, please, and stop ironing on the bed. You sleep on the bed. You may forget to even turn it off. You may forget to turn it off. And thanks to all my people who work in education who keep sending messages saying that, you know, a teacher said we come to Okonfa Sort site, which is very close to Piku. He's saying that probably they should add Piku to their excursion route, just so that I think we need to teach first aid again. We learned it in school. I don't know how, somehow, some way it's vanished. But
the school should engage. I know that there was a time ago in one district where I was, we sent letters out to schools. We made ourselves available. They didn't even invite us. That we need, because children get injured in school. Children have chronic diseases. They need to come to the hospital. They need teachers to know how these children's conditions are sickles and how to co-manage with us. Children have all these things, and sometimes some schools even will say that I'm not allowing you to leave. I mean, just about 3 weeks ago, one secondary school here, they were not allowing the child to go.
Yeah.
I don't know how severe it was.
It was.
Right. Schools should really engage, and I think that if they are willing and they invite us, we can have that kind of educational conversation with the teachers, at least the initial first aid in schools, and how to manage children with chronic conditions, asthma, sickle cell, how they can collaborate in managing them. It's very important.
Someone sent a message she sent a message from Chapa Church. She's saying that close to our area, there is someone who has set up a recycling plant and keeps burning rubber. So we keep inhaling the fumes from the rubber. He's saying that kindly ask your guests if we are at risk of anything. Dr. Adabie, she wants to know if they are at risk of anything.
Yeah, definitely. I'm sure this is air pollution. There will be some form of air pollution. I will recommend that they talk to the area, the community, the leadership in the community, engage the manufacturer, if I can put it that way, whoever is doing the new processing, to see how best they can protect the environment and the community. The second one is also to approach the Environmental Protection Authority. Their authority now, they can approach them, talk to them, and I'm sure they'll find solutions for them. But medically, yes, there are several immediate and long-term complications that can arise out of that. Immediate complications like children, as I want to focus on children, but children and adults who have airway disease. If they have problems with their lungs, their airways, they can react badly to that and have to go to the hospital much more frequently than they used to. You spend more money on them, so it can be a problem. Long-term wise, it can also accumulate in the body, cause problems in the brain development, can cause nutritional problems, anemia, can cause cancers. We know that these plastic products that we have, they one way or the other, they find their way into when they find their way into our food and our body, they can accumulate and then create problems. Unfortunately, currently we don't have that capacity as a medical setup to detect and then to manage long-term and even sometimes the short-term ones. Asthma can be handled, allergic reactions can be handled, but the long-term ones we have not. I'm not sure. Let me say I am not sure whether we have gone that far. So it's an area that I think some of our colleagues will also need to look at.
We need to look into.
Health,
You are listening to the Health Lounge on Orange FM. My name is Dr. Jima. I'm here every Saturday. Yes, and for all those who are, I know I've been doing this for 5 years. So if you're hearing me for the first time, where have you been? I've been doing this for 5 years. So I'm here every Saturday from 8 to 10. And thanks to all those who are sending messages and you're enjoying the conversation and you appreciate the fact that we are taking injuries in children seriously, even up to the level of kids who end up in the pediatric intensive care units. Someone wants to find out that are there injuries that are peculiar to Esikafor? And then are there injuries that are peculiar to Antiba? This is a question someone that asked that there are some injuries that he thinks that it's, if you're a rich kid, then you get that problem. Because he's saying that unknown.
Interestingly, the data shows that home injuries happens more with Omomo Yesikafor. If I'm allowed to use the word rural and urban area, it's more common in rural areas than urban areas. But again, some injuries are common, but there are some that is based on the economic. For example, if I don't have a swimming pool, right? Yes, I may drown, but mine might be a bucket or a basin, right? But the risk of swimming pool is different. Being locked up in a car, if I don't have a car, right? Obviously, that risk is not as high. So there are some type of injury that lends themselves to more of like your economy. But despite that fact, I mean, everybody is at risk of some form of injuries, and that is the most important part. You should be conscious of who you are, your environment, the type of injuries that you are at risk of, your child is at risk of, and then put in place the necessary measures. I think that's what most matters. It's not about me being, me the music and my family. It's not true. You have your own type of risk factors also, and the things that can potentially happen to your child.
Elom is saying that he as a medical doctor he's advocating that sometimes when you're with your children, look for them. Like. All of a sudden, the house is quiet.
You don't want the quiet.
Hello, I agree with you. I have a son. 5 minutes doesn't maintain a car. I have to go and look for him because, so he's saying that when you're with kids in the house, and all of a sudden, if you are go and look for the child because they may be somewhere.
He's conducting an operation.
Ellen, or the girls are not like that.
Yeah, worse.
You understand? He's saying that when you have kids at home and you know that they are playing somewhere, and all of a sudden you can't hear them talking, screaming, laughing, drop whatever you are doing and go and look for them. You may never know what has happened. Please, don't think that and saying your mind or when you there's
he's absolutely
yes. There's probably something that is happening. BBC. So Elom, thank you very much. And then Doc, how do we advocate for kids to, older kids, not the younger ones, to also take their own safety into consideration? Like, as they grow, they all mature. How do we encourage them that this will harm you? If you're riding a bike, put on a helmet. If you're going, how do we inculcate that into our kids?
It starts with conversation at home. All right. And then also, at the same time, also starts with engagement with the health workers or health workers who are engaged. Capitalize on every opportunity that you get an encounter with families in the hospital. We can bring it up mundanely in conversations with them to engage them and bring them to speed. What are some of the things you have done to protect your teenager? Teenagers or adolescents have their own peculiar accident problems, accidents resulting from joining gangs, joining groups, using tools to harm themselves, like you are saying, also riding bicycles without helmet, without protection, doing all sorts of things. You go out, drink during the weekends, over the weekend, social drinking, and then lose their senses in terms of protective senses that help them protect themselves.
Yeah.
So we need to engage them. That's where it starts from. We need to show them examples of bad things that has happened. We need to provide them with evidence of what can be done. And again, we need other groups, civil society groups to come in here, dealing with adolescents, to take all this into consideration. Here, little bands here, they also, from foreign body smoking and all these things, can also develop problems that we need to address. And they are very important constituency that we have virtually neglected them.
Yeah.
I'm happy that you have raised this at this point in time. So we need to do something about that. We need to bring them to us. We don't need to push them away. Even the most difficult ones that you are handling at home. Yeah. Give them room. I mean, the fact that they are standing, it being difficult means they are standing up for themselves. And you need to know how to manage such characters. Okay. It's better. They all are. Every child is positioned to succeed.
Okay.
The quiet child is positioned to succeed in a way.
Okay.
The manipulative child is positioned to succeed because then they can argue for themselves. They can find way out of tight corners to safety.
Yeah.
All right. The destructive child is even in that destructive stage. Is wired to change society and make society better in one way or the other. And if we see them that way, rather we need to modulate some of these things to direct them, to direct the energy in the right path, the right channel. I guess that is the way we need to do.
There's a listener who says that I shouldn't mention his name, so I won't. So he's saying that my husband left his whiskey. Says my husband left his whiskey on the table, and my son drank it. I felt so embarrassed taking him to the hospital, but saying that I had to go anyway, and I had to find a way to lie, saying that I'm not proud of it, but how should I have said it, Ellen? They will come and meet you people first. Ellen, they'll come and meet you people first. So, it's not deliberate. How I'm like, how should they say it? Like how should they say it?
I think lying is not a good way to approach this. When you come, just tell the nurse, it was there, and then the child just took it. Just say the truth.
Don't come and lie to the nurses.
Don't come and
nurses, they are experts at seeing to all forms of lies. So she should have just come and said, what?
Maybe I'm like...
Yeah, exactly.
Maybe, sir.
Yeah, it happens all the time. It's not only alcohol. Other things. Parents' medication in the house, depression, antihypertensive medication, diabetic.
But sometimes the parents feel like that's so irresponsible of them.
Oh no!
So there's this guilt.
Remember, we use the word accident. Accident can happen in my house. It doesn't mean that I have completely neglected. But if it becomes repetitive, I do it over and over again, then there's an element of negligence. Neglect. We are neglecting our duty. You've not neglected your duty if your child accidentally takes something. And you go to the hospital. You know, all these things are the treatment is time bound.
Okay.
The earlier you identify it and intervene, the lower the cost. The cost can be money. The cost can be complications. Residual effect that can be akorana dem.
So what you feel to do?
It reduces all these costs.
Yes, I know. Your money so on.
He wanted help. Doctors are not magicians. They can help you.
No, your man is so tented, and it's not in the system. But you see, I can imagine how people would think. I think she was thinking about how would they judge me?
And out of curiosity, maybe I could diagram feel say you cry naturally. That you me no. But once in a while, I could be a stubborn. The gang leader, yeah, no, so a gang leader, no cry, me feel so I cry. Yeah. You see, I felt the best sort to be.
Like, take the child. Don't instantly become. Don't look for the cane and instantly start caning the child. It's an accident. It's an accident that has happened. And please, like we're saying, come to hospital early. Elliot, how do we come to Piku? Can I just walk to Piku?
Yes, so you can't just walk to Piku.
Okay.
Yes, so Piku, the decision to come to Piku is dependent on certain criteria. Mm-hmm. So usually our patients will come from the emergency. I think that Adabie earlier on alluded to that. Mm-hmm. You come to the emergency, we try to stabilize you. Mm-hmm. Some of them would even go home right from the emergency. Some we stabilize, we continue their care, they are stable, they go to the ward. Okay. Others keep on getting unwell. And for some of them, immediately they come, their life threatening. They don't even belong to the emergency.
So they transfer them.
So they are the ones that are transferred. So there's a criteria, and I think he explained it, the life threatening things.
So you come through the normal emergency.
Yes.
Okay.
Yeah, there are some other patients, and you don't say, I want to go to Piku. Is the healthcare team that would assess and say this one has to go to Piku. So they will assess and say this one has to go to Piku. This one we can manage at the emergency. This one is okay. You can even go home. Mm-hmm. So that is part of why we are trained as doctors to take that decision. Other group of patients who come to Piku are our surgical specialties. So those who do the heart surgeons. Surgeries, the lung surgeries, the operations, right? Some children, they go to theater, and right from before they go to theater, they have planned that this child after, because of the level of operation we are going to do, the sickness has to come to the intensive care unit. Sometimes they didn't expect they were going to come, but they go, there's a complication, they are brought to the intensive care unit. And then, accidents, so they don't come through, they usually come through the main emergency at Konfanoche. Those also will come to the pediatric intensive care unit. Yes.
Time flies when we are having fun. I will give Dr. Adabie the last word. So, Ellen, any final words before we go? And don't forget to say hello to your friends, or else they'll have challenge with you. So, any final words before we leave the studio?
I would like to say any little thing, as I said earlier, bring the child to the hospital. You should know it's a life-threatening thing. Anything can happen at any time. So don't be shy. Don't put fear on you. Just come. We'll see you. Nurses are nice people. So we'll see you.
All right. Elliot?
Yes, so I would want to say that we are happy. There's a time in life where you'd have to take stock. If life is all about chasing goals, and dreams, and then trying to aspire, you never take time to rest, reflect, and then enjoy the fruits of your labor to make yourself feel good. There's no point to all this struggle. Right? And I think that's where Piku has come. 10 years of all this, the legacy, the life saved, the people. In fact, now we're actually training specialists to be critical care specialists. I'm one of them. Right? So we've come a long way from being the first and all that. So we are happy, but we still have a long way to go, and would ask the public to support us. We've come this far partly because of the support people have given us. Every now and then people come to just visit, say hello. People come to make donations. There are people who come to Piku, they have nothing. Despite all these expensive machines, they have nothing. And sometimes donations and things. And we really want, if you've been doing that, we really much appreciate what you do, and we'll ask you to continue and draw other people to do that. And then if you're hearing about that for the first time, you just pass by and say hello. And then also draw people to come. We have thrived on people's benevolence and generosity, and we are welcome to do more. To join.
Thank you. Dr. Adabie?
Yeah, I'll say that children investing in in your child is the best thing you can ever do for yourself and then your family and the community and society. Investing in child health is also very important. It's a neglected area which we have been advocating and fighting for all areas. What has been lacking in the past was intensive care for children, critical care, and fortunately we have one, just like Elliot said. And we are proud as Ghanaians, as Ghana, what we've been able to do with pediatric intensive care. And Komfanoche can hold its chest very high among its colleagues in the, let me use the word colleagues, in Africa. It's the third center outside, the second center outside South Africa and the North Africa to be training pediatric intensive and critical care. So, and then Ghana, we are the first. West Africa, we are the first. Ghana, we are the first. So something to be proud of and something to cherish as we look forward for more years, because the health of our child, even the most sickest one, we need to give them the chance to survive.
But are we having any celebration, any commemoration, anything happening?
Yes. For the next 1.5 months, we have a number of things outlined.
Okay.
Some of them to highlight the work we have done. So we have I'll leave Ellen and Co to talk. If you want to talk about that, I'll leave that to them. But yes, we want to talk about it. We are even having time with those who have survived PICU. So they will highlight. So that.
You invite us for that session. We would like to come and cover it. I would like to come and cover it as well, and then showcase it to the general public to sort of understand and appreciate what you have done. But we ran out of time this morning on the Orange Health Lounge. As always, my name is Dr. Jima. It's been 2 hours. It's been 2 hours, believe it or not, of mentally stimulating conversation. And it's been educational. I know it's been educational. The messages I've received alone tell me that this has been the most educational show. Don't worry, next week I won't come so we can replay this. But suffice to say, the Orange Health Lounge is on your radio every Saturday from 8 a.m. to 10 a.m. We do this every Saturday. And like I always say, we only bring those who know so that they tell you the right things that you need to know. My guests this morning have been Dr. Med. Dr. Sorry, I should add Med. I don't mind him. Dr. John Adabie, Appiah, pediatric intensivist. If I say I'll mention that accolades, I won't finish. But he's an inspiration to all of us. Ellen, Opoku, Danquah, and then Dr. Elliot, Akoto, who is also in training as a pediatric intensivist. We're here on your radio every Saturday, 8 to 10 on the Health Lounge. My name is Dr. Jima. Enjoy your Saturday. Goodbye.